Hello, I'm Dr. Adriana Potter. On the Let's Get Physical today, we're going to talk about knee instability and how to recover from that. Most of the time, people can have an innate instability that they're born with that hypermobility, and they have a lot of issues with subluxation and dislocation, and that happens with a variety of movements throughout the day. Or you can have an injury that now results on knee muscles weakness and instability at the patella. These videos also will help patients with patellofemoral syndrome issues, people who have some sort of arthroscopic surgeries to the knee for whatever reason. Usually when you have surgery, you will be doing physical therapy, and they will guide you with the specific exercises. But if you have a minor injury that did not require physical therapy or surgery, and you want to start doing these things at home, the rule number one is that these exercises have to be pain-free.
In this video, we're going to go over an knowing bearing exercises, which is also known as open kinetic chain exercises, and includes quad set, straight leg raise on your back, single leg circles, hip abduction and adduction on your back, and sideline, sitting and marching, sitting and abduction, adduction, and sitting knee extension with the option to do abdominal stabilization during these exercises.
Alrighty, so let's get started. So the first thing that you want to be doing with this exercise is actually be able to have a good quad set. So if you're able to see on my knee that you're going to actually press the knee, and you should see that kneecap moving up and the quadriceps muscles kind of tightening up on you. And you're going to hold the quadriceps sets for 10 seconds. 5, 6, 7, 8. And let it go for about 5 seconds. And you're going to press it again, hold it for 10 seconds. You should see the kneecap sliding up. Hold it for 6, 7, 8, 9, 10, and let it go. The second exercise you want to be doing it, you can be like supported sitting like this or laying down. But once you're able to hold it 10 seconds, on the quadriceps, you're going to try to raise the leg and down. And if you are trying to raise your leg and your knee is bending like this, you're not ready for this exercise. You want to make sure that you're able to keep this quad set activated and lock into the knee. And if you start getting a little bit of the cramping in the leg, it's probably because of the positioning. So go ahead and lay back, get abs working, preferably laying down, push the leg down, lift it up and down, up and down. And you're working on abdominal muscles, so you kind of prepare you for more stability on the standing position. So you want to be doing this quad set with the leg raise for 10 repetitions. And these few exercises that we have in here for early rehabilitation, they're called open kinetic chain exercises, which means you're not weight bearing on the leg when you're doing these exercises. And 8, and 10. Good. All right. This next exercise, it is a combination of the first two. So with the involved leg that you have the weakness or the instability, you're gonna try to lengthen the leg, all right? If you had good flexibility, you might be able to keep the abs down, but you might be able to lengthen the other leg and active. Push this leg down, the leg that is straight down, and actively lengthen the leg in here. So there is a quad set happening in here, and there's a quad set happening down the bottom leg as well. And you want your abs engaged. This is a Pilates based exercise, and you're gonna do a circle and stop, circle and stop, and 3. And abs are engaged the whole time, and 5. Reverse the circle, 1 and 2 and 3 and 4 and 5. Switch legs and do the other one, same thing. You do a circle and you stop each circle. Abs stay engaged the whole time. 3 and 4 and 5. And the other one, the other direction, and 4 and 5. Alrighty, so those are the first 3 on your back. The next one for your open chain is abs are always engaged no matter what. Quad set happening on the leg that is on the top, the bottom leg is bent. You're gonna raise the leg up and down. Those are my toe touches. And make sure that you're not raising the leg up in here, because this is wrong. You're not doing the right way. You have to roll your hips forward and then do the raising up and down with the leg, with the knees locked. So when you're not weight bearing in a knee, it's okay to lock for these exercises. You actually want to keep the knee locked when you're not weight bearing for this exercise. And 10. Now the next one is the single leg circles. Abs also engage. Knee is locked because you're not weight bearing. When we go to the next level, we'll talk about the position of the knee in a little bit so you don't get confused now. 5, reverse the circle. And 2, and 3, and 4, and 5. Alrighty. Now with the bottom leg straight, top leg is bent, you're gonna do the hip abduction in here. Quad set also happening here. If this leg bothers you, you can put a little bit lower and you can roll a little bit back into your hips for this one. And 4, 5, 6, 7, 8, 9, and 10. Now you're going to switch to the other side and do the same exercise to the other leg. Even though your instability might be on only one side, you're always going to be doing this exercise bilaterally. So pause your video and do the other exercise for the other legs, okay, for both of them. So the next one we're going to do that is still open chain is actually abs in and doing a little bit of this knee marching on the edge of the bed, getting ready to do things in a different position. Then you do this 10 times and you can get a little bit of the core stabilization and kind of getting ready to do more physical activity. And there is no stress on the knee, no pain in the knee when you're doing that. And then you can also do leg extension and down, extension and down. And you can add weights to your arms so your body is still in good conditioning as you're doing these exercises for knee stability or recovery from injury or just building up your strength. Alrighty, here. So that it is your straight leg on the edge of the bed with the option to do a little bit of abdominal muscles with the arm reaching above the head. Then you're gonna get your loop put around your knee, okay? And you're gonna do the hip abduction in here. So we're working mostly in the hip muscles. 7 and 8. Keep always working your abs. Never forget to work your abs. Keep engaged so you always prepare for good posture for the next level of exercise we're gonna be doing it. Okay. With the block, the next one is hip adduction. We're gonna keep the band because I don't want to keep moving in and out. And you're gonna just squeeze it. And you're doing a little bit of inner groin muscles. And once you're progressing to this, you're gonna be doing this first, almost like open chain exercises. If you're sitting on the edge of the bed, your legs are dangling, so you're actually not really doing any weight bearing into that knee, and you're still doing the band or the block or ball or pillow. It squeezes on the edge of the bed.
All right, so let's go over of this week 1 and 2 of stabilization exercises on the open chain, which is a non-weight bearing exercise. So we went over the quad set, straight leg raise, single leg circles, hip abduction, sideline leg circles, hip adduction on the side as well, sitting hip abduction, sitting hip adduction with the block, and a sitting knee extension, as well as your marching with the option to do your arms. You should be doing 2 sets of 10 about 3 to 4 times in a week. And again, the rule for this exercise is that you don't have pain or increase of pain as you keep doing these exercises.
This is your series from Let's Get Physical Exercise for Knee Instability and Recovery from Minor Injuries. One more time, this is only for people that have not had any surgeries. Usually you want to be doing with a physical therapist if you had any sort of arthroscopic surgery or knee replacement. But this is something that can help you to guide further down the line when you need a little bit more reinforcement of the exercise that you can do at home for strengthening and maintaining that benefit that you get from your sessions from the physical therapist. I hope you enjoyed the video. Don't forget to subscribe. I'm Dr. Adriana Potter, and Let's Get Physical Series on knee stability. Enjoy, and don't forget to press that bell button to get reminders for your subscriptions and the videos in the future. Have a great day.